So we'll move on. Good morning, students. We'll move on to the next topic, that is models of preventive psychiatry. So models of preventive psychiatry. So in this models of preventive psychiatry, it includes mainly the levels of prevention. So we'll see what are the roles of nurses in different levels of prevention. So there are three different levels of prevention. One is primary prevention, secondary prevention, and tertiary prevention. So that is, we'll see one by one what is the role of nurses in this levels of prevention. So first is primary prevention. So what is this primary prevention? So primary prevention, so it usually prevents the occurrence of mental disorders. Okay, it prevents the occurrence of mental disorders. So how it is preventing the occurrence of mental disorders? By strengthening individuals, family and group coping abilities. Okay, by improvising, like, so what is that? Usually that is that. So that is mainly, so primary prevention, it's like it helps in preventing the occurrence of mental disorders by how? By strengthening the individual, family and coping abilities. Okay, by group coping abilities. So by this it usually prevents the occurrence of mental disorders. Okay, occurrence of mental disorders. So we'll see what is the role of nurse in this primary prevention. So normally in this role, like in this levels of prevention, okay, in this levels of prevention, the role of nurse, it is very important. Okay, the role of nurse, it is very important because they have a key position. Okay, they are the key position, or they are important position. They have an important position to identify individual, family and group needs, conflicts and stresses. Okay, so that is, so my community mental health nurses, so they are usually having a key position to identify the individual, family and group needs, conflicts and stressors. Okay, conflicts and stressors. So they usually play an important role. Okay, they usually play an important role in identifying the high risk groups. Okay, they play an important role in identifying the high risk group and also the preventing the occurrence of mental illness. Okay, and also preventing the occurrence of mental illness. So that is primary prevention. It is nothing but where we will be, like what we will be doing. So mainly we will be preventing the occurrence of mental disorders. Okay, preventing the occurrence of mental disorders by strengthening individual, family and group coping abilities. Okay, by strengthening individual, family and group coping abilities. So in that role of nurse in the primary prevention, so it is that usually they occupy a key position. Okay, they usually occupy a key position to identify the individual, family and group needs as well as conflicts and stressors. So they play an important role. Okay, they play an important role in identifying the high risk group and preventing the occurrence of mental illness. Okay, preventing the occurrence of mental illness. So what are the interventions that they have to take? Okay, they have to take certain interventions in order to prevent the occurrence of this mental illness. Okay, in order to prevent the occurrence of this mental illness, they have to take certain they have to take certain interventions. So there are different interventions. There are many interventions that they have to take in order to prevent the occurrence of mental illness. The first intervention is individual centered. Okay, the first individual is individual centered. So under this intervention, what they have to do is that they have to give proper antenatal care to the mothers. Okay, they have to give proper antenatal care to the mothers. They have to educate regarding the effects of drugs as well as prematurity. Okay, they have to they have to educate them regarding the adverse effects of drugs and prematurity. Okay, adverse effects of drugs and prematurity. So that is usually what happens. So in this mainly, so what is that? In this certain interventions they have to take, and so in that intervention, the first intervention that they have to take, it is mainly individual centered. Okay, the first intervention is mainly individual centered. So under this individual centered, what they do, so that is usually they have to give proper antenatal care. Okay, they have to take proper antenatal care to the mother. Okay, they have to give proper antenatal care to the mother, educate her regarding the adverse effects of the certain drugs and prematurity. Then they have to go see that correctly by timely time basis they will go for obstetrical examinations. Okay, they will go for obstetrical examination, or obstetrical assistance should be taken so that they can guard against the ill effects of anoxia. Okay, ill effects of anoxia as well as injury to the newborn at birth. Okay, as well as injury to the newborn at the birth. So that is, we have to ensure that timely and efficient obstetrical assistance are taken. Okay, so that we can prevent the ill effects of anoxia and as well as prevent the injury to the newborn at the birth. Then proper dietary plan should be made. Okay, so then it is usually what happens. So dietary plan should be made for both infants who are suffering from metabolic disorders. Okay, so that is, dietary correction should be made. Okay, proper dietary correction should be made to the infants who are suffering from metabolic disorders. So what are the metabolic disorders? So that is usually, you all know what are the metabolic disorders. So those metabolic disorders, so if the infants are suffering from, so we have to go with proper dietary correction. Okay, we have to go for proper dietary correction. Then if the infants are suffering from or the mother are suffering from endocrine disorders, that has to be taken care. Okay, that has to be taken care, or proper treatment should be provided. So next is usually regarding, so proper laws should be made, okay, so proper law or training, so proper training program should be given, okay, so proper training program should be given for children who are mentally and physically handicapped, okay, so proper training should be taken for the children who are having mental, like who are like physically and mentally, they have to give proper training for the physically and mentally children, handicapped children, like blind, deaf, mute and mentally subnormal, okay, and mentally subnormal. So that is usually what happens. So proper training should be given for the physically and mentally handicapped children, such as blind, if they are blind, if they are deaf, mute, as well as mentally subnormal. Then we have to give counseling for those parents whose children are physically and mentally handicapped, okay, we have to give counseling for those parents whose children are physically and mentally handicapped. So that is usually about this interventions that is taken individual centered, okay, individual centered, where proper antenatal care should be taken, and then proper obstetrical assistance should be taken, dietary correction should be made, endocrine disorders should be corrected, and then training programs should be done, as well as counseling should be given. So next is individual oriented to the child in the school, okay, interventions that is like what are the interventions that we are giving regarding orientation to the child in the school. So the next intervention they will be taking, it is that it is mainly interventions that is taken related to child in the school, okay, related to child in the school. So what is that? We have to teach both the parents as well as teachers, okay, we have to teach both the parents as well as teachers regarding growth and development of the child, okay, we have to teach both the parents as well as the children, both the parents as well as teachers regarding the growth and development of the child. So that has to be done. Then we have to see that we have to identify the problems, okay, we have to identify the problems of the performance and emotional disturbances among school children, okay, so we have to identify the problems such as problems of scholastic performance and emotional disturbances among school children, and giving timely interventions, okay, and giving timely interventions. So that is usually what happens. We have to identify and we have to identify the problems of scholastic performance and emotional disturbances among school children, and the school teachers have to be taught that, okay, school teachers have to be taught that, so that they can recognize it as early as possible, okay, so they can recognize the symptoms as early as possible, okay, they can recognize the symptoms as early as possible and refer them to the appropriate hospitals, okay, refer to them to the appropriate hospitals. So that is usually about this like interventions that is taken to regarding the orientation of the child in the school, okay, orientation of the child in the school. And next is usually, so what are the interventions that within teachers should be taught, parents and teachers should be taught regarding growth and development, and then we have to identify the problem of emotional disturbances and scholastic performance among the children, and the school teachers should be taught them like to identify the symptoms as early as possible and refer to the appropriate agency, okay, and refer it to the appropriate agencies. Next is that like family centered interventions, okay, so next interventions that we will be taking, it is family centered interventions to ensure harmonious relationship, okay, to ensure harmonious relationship, okay, the next intervention that we will be taking, it is family centered interventions, okay, family centered interventions to ensure harmonious relationship, okay, to ensure that harmonious relationship. So in this mainly what is that we have to first consult with the parents, okay, we have to first consult with the parents regarding the disciplinary measures that have to be taken, okay, so that is consulting with the parents, okay, we have to consult with the parents regarding the what are the disciplinary measures that has to be taken. Then we have to promote like health communication in the families, okay, so we have to promote that they go with proper communication, okay, they go with proper communications, that is to be done. And then usually see that after that we have to ensure that there is harmonious relationship among the members, okay, we have to see that the relationship that is maintained in the family, okay, the relationship that is maintained in the family, it has been like they are maintaining it appropriately, okay, they are maintaining appropriately, they are maintaining it harmoniously, there is no stress or something in between the relationship, so that has to be checked. So that is family centered intervention to ensure harmonious relationship. So in this we have to see like we have to consult with the parents regarding the disciplinary measures that they are taking, and also we have to see that we have to promote open health communication in the families, as well as we have to ensure harmonious relationship among the members of the family, and teaching healthy adaptive techniques, again teaching healthy adaptive techniques, so that has to be done. So next is interventions oriented to keep family intact, okay, interventions oriented to keep family intact. So next interventions that we will be taking, it is that to keep the family interventions, that is to keep the families intact. So what are the things that we have to do is that, like we have to mental health education should be given. Okay, mental health education services should be given in the child guidance clinics. Okay, child guidance clinic. So regarding what are the health education that we can give in the child guidance clinic, it is regarding about the how to rear a child, how to bring up a child. Okay, how to bring up a child. And then parent teacher association. Okay, parent teacher association should be done regularly, so that we can understand about the triad relationship between the teacher, parents as well as the child. So in order to understand that, we have to go with extending this mental health education services. Okay, we have to extend this mental health education services at the child guidance clinics. Okay, at the child guidance clinic. And then strengthening social support. Okay, we have to strengthen the social support so that we can help them. Like social support should be given for the aged people who are frustrated. Okay, social support should be given to the aged people who are frustrated, and also helping them to retain their usefulness. Okay, helping them to retain their usefulness. So that is usually about this thing. And then counseling should be given. Okay, so counseling should be given to the individuals. Okay, proper counseling should be given, that is marital counseling should be given. Okay, so proper marital counseling should be given, so that they will not be having, and for those people who are having marital problems. Okay, for those individuals who are having marital problems. So that is usually the interventions in which these are interventions where we'll take in order to keep the families intact, in order to keep that families are functioning properly. So what are the interventions that we have to take? So interventions that we have to take, it is regarding like extending mental health education services. So we have to extend the mental health education service in the child guidance clinic, where we will be giving education regarding the child reading practices, as well as to understand the triad between the parents, teachers and children relationship. Then we have to strengthen the social support for the aged people who are frustrated, and then we have to provide marital counseling for those individuals who are having, for those couples who are having marital problems. So that is usually there. So next is interventions for families in crisis. Okay, so we have to take certain interventions whose families are in crisis. So what is that? In the crisis situation, okay, in the crisis situation, the child usually passes from adolescence. Okay, that is birth of the new baby, then retirement, then menopause, death. So all these things will be there in the family. Okay, all these things will be there in the family. So therefore, in order to handle this crisis, we have to go certain interventions, that is mental hygiene clinics should be visited. Okay, mental hygiene clinics should be visited. Psychiatric first aid centers should be given. Okay, psychiatric first aid centers should be open. Then we have to go with walk-in clinics. Okay, then we have to go with walk-in clinics. So these are the interventions of the family should be taken during the crisis in situation. So what are the things that we have to do? That is interventions that is taken for families in crisis. So that is in developmental crisis situation, like child passes like from birth of the new baby, then passing through the adolescent, menopause, retirement, death. So all these things usually occurs in the family. So therefore, in order to handle with this crisis interventions, okay, in order to handle with this crisis situation, interventions has to be taken. So it is like going for mental health hygiene clinics, and then also psychiatric first aid centers should be visited, walk-in clinics. So all these things should be done. So that is usually about this interventions for the families in crisis. So next is mental health education. So what are the next intervention that we have to take? What are the next intervention that the nurse has to take? It is mental health education. So what is done in this? So we have to conduct mass health education. Okay, we have to conduct mass health education. So when conducting education, health education, so we have to see that they make use of film shows. So they make use of film shows or flashcards, appropriate audiovisual aids. Okay, they can make use of film shows, flashcards, appropriate audiovisual shows, so that we can tell them or we can educate them regarding prevention of mental illness as well as promotion of mental health. Okay, so that we can tell them the importance of prevention of mental illness as well as promotion of mental health, that is in the community. Then we have to educate health workers. Okay, then we have to educate health workers regarding prevention of mental illness. Okay, regarding prevention of mental illness, so that they can function properly. Okay, so that they can function properly. So that is usually about this in the mental health education, where we have to conduct mass health education, by making use of film shows, flashcards, appropriate audiovisual aids, and also to regard, so that what are the health education that we will give regarding health education that we give, it is regarding prevention of mental illness and promotion of mental health in the community. Then we have to educate health workers. Okay, we have to educate health workers regarding prevention of mental illness so that they can function properly. And the next intervention that the nurse has to take, it is society-centered preventive measures. Okay, society-centered preventive measures. So this is done mainly for community development. It is done for mainly for community development. So that is usually for those families. Okay, they will be taking measures for those families who are being culturally deprived. Okay, we take certain preventive measures, or we take certain interventions for those families who are culturally deprived. Okay, who are culturally deprived. And they require better hygiene living. Okay, they require better hygiene living for such families. Okay, who require better hygiene living conditions, proper food, education, health facilities, recreational facilities. So that is usually for such individual we go with giving them certain. So we go with taking certain intervention so that they will be getting all these things which they are deprived. Okay, so that they can get all these things which they are deprived. So that is, so mainly in this, it is mainly this society-centered preventive measures. This is mainly taken for better community development. Okay, for better community development, and this we use for those individuals who are who are culturally deprived. Okay, who are culturally deprived. For such families, we just go with giving them proper intervention. So these are usually the interventions that is taken. That is the role of nurse in the primary prevention. So includes individual-centered interventions, interventions oriented to the child and the school, family-centered interventions to ensure harmonious relationship, interventions oriented to keep families intact, interventions for family in crisis, mental health education, and socially centered preventive measures. Okay, so this is about this primary prevention, where we usually use this primary prevention to prevent the occurrence of mental disorders by strengthening individual, family, and group coping abilities.